While indicators like the doctor-to-patient ratio and healthcare staff-to-patient ratio are useful in providing a broad comparison across time and across countries, we need to be mindful of differences in clinical practices and operating environments across the different institutions and countries. Between 2007 and 2012, Singapore's doctor-to-population ratio improved from 1:620 to 1:520. Similarly, our nurse-to-population ratio also improved from 1:205 to 1:154. To meet the needs of a growing and aging population, my ministry has worked with the public healthcare clusters to expand our pool of public sector healthcare professionals. The number of doctors in the public sector has increased by more than 50% since 2007 to around 6,200 in 2012, while the number of nurses has increased by about 70% to 21,000 over the same period. The pay of healthcare professionals has also been enhanced in 2012 to be more competitive against the market, to better attract and retain healthcare professionals in the public healthcare sector. At the upstream training level, we are expanding intakes to meet the projected additional 20,000 more healthcare professionals needed by 2020. The medical intake will further increase this year by another 50 students with the opening of Singapore's third medical school, the Lee Kong Chian School of Medicine at the Nanyang Technological University, bringing the total medical intake to around 400. This will further increase to 500 over time. Likewise, we will increase the nursing intake to some 2,700 eventually. We are also working with the public healthcare clusters to optimize the use of our public healthcare workforce through productivity measures. These continuous efforts to improve workflow, redesign jobs, and better utilize technology will not only drive efficiency gains and savings in operating costs, but also will provide higher job satisfaction for the healthcare workers. We agree with Mr. Gan Thiam Poh that there should be an increase in emphasis and investment in preventive healthcare in the face of our aging population. In view of this, we are investing in the promotion of healthy lifestyles, including the adoption and maintenance of good dietary habits and regular physical activity, as well as leading a smoke-free life. We are also encouraging regular health screenings to facilitate early detection and management of chronic diseases. The Integrated Screening Program, or ISP, was introduced in 2008 to encourage Singaporeans aged 40 and above to screen for chronic conditions, including diabetes, high blood pressure, and high blood cholesterol. To improve the health of our adult population, who will become the next generation of elderly Singaporeans in time to come, we have implemented the Workplace Health Promotion, or WHP, program to provide a comprehensive support infrastructure for companies to introduce health promotion policies, activities, and programs for their workforce. In addition to health promotion, we are investing in good primary health care. The Chronic Disease Management Program, or CDMP, available at enrolled GP clinics, works in conjunction with the Community Health Assist Scheme, or CHAS, to ensure the accessibility and affordability of medical treatment for persons with chronic conditions in the community. These help improve individuals' health outcomes, as well as prevent the deterioration of the chronic conditions and the development of complications later in life. As part of the public consultation on the Healthy Living Master Plan that was announced at the recent Committee of Supply debate, my ministry will get feedback and suggestions on how we can make healthy living, including preventive care, a part of our everyday fabric. The ongoing review of our healthcare financing framework will also cover our funding framework for preventive health to ensure that it remains affordable and accessible to all Singaporeans.